Welcome back. Many thanks for staying with us right here on Daybreak. My name is Wahiga Mora. We continue with our coverage of what's important for you. Now, before the break, we were focusing on that U.S. election, but now we focus on what's happening in Kenya. A moment of decision for the country in the face of the rising COVID-19 numbers, a struggling economy. We've also seen a defiant political class. And we know that today from 10:30 a.m., President Uhuru Kenyatta expected to meet with county governors to discuss the way forward in the face of a surprising rise in the number of COVID-19 cases. What needs to be done? We speak to experts in various sectors right now. Joining me first in studio is Wilson Sosion, SecGen, Kenya National Union of Teachers. We'll also be joined in studio by Chibanzi Mwachonda, the SecGen of KMPDU, representing the medical fraternity. While virtually, we will also be joined by Senator Sylvia Kasanga, nominated senator and chair of the ad hoc committee on the COVID-19 situation in Kenya in Senate, and Janet Ouko, who is an education expert. Let me start with you, Sosion. You're here with me in studio, and I want to get your quick reaction to what we saw in Busia, or the announcement we got from Busia yesterday, where 52 students, 6 teachers, 2 support staff members have tested positive for COVID-19, sparking a panic amongst colleagues, the school fraternity, the community, dare I say, the country. What are your thoughts on this? Because we spoke about the possible dangers of reopening schools 3 weeks ago.
Yes, indeed. This is envisaged, and it was envisaged that there will be either localized or cross-country spike of the disease. That we were properly guided by the experts that it would occur. And it is not only in Kolanya boys. We saw at Tononoka, where the principal actually succumbed, and quite a number of teachers have died. And what we witnessed at Kolanya yesterday is one of the many expected cases. And I think what we should be talking about now is how do we approach resumption of schools in the face of the furiously surging COVID-19, which we've witnessed now several more deaths than ever before. The death rates per day is quite alarming. And it's not only in Kenya, it's global. We've seen reactions in Europe, what they're doing in terms of COVID. Countries are getting back to thorough and serious lockdowns. So really, this is something we have to look at it globally against the backdrop of the surge of the virus in the country and the envisaged resumption of millions of learners who are out there at home, and this disease has spread to the communities. So still, they are neither safe at home. The students who are in school, of course, when you talk of Kolanya, there's possibilities that many of them are infected. And the question is, should you send them home? You'll be risking the lives of their parents. And this is where this is the most sensitive thing that government really must now currently address. When we reopen schools and we allowed for a small group of students, Form 4's Class 8
yes.
and Form 4,
yes.
It was for schools to test the infrastructure of preventive measures of COVID-19 in line with the protocol. Okay. So that right now, these are some of the challenges we are facing. What is expressing itself through Kolanya, what expresses itself through Tononoka, and there could be very many others, so that now those are lessons and experiences that we have to learn from. And
I guess Honorable Sosion, some would ask how have we fared on that test? And let me bring in Janet Ouko and get her view on this. In a moment of soul searching, looking over the last 3 weeks, should we have looked at this education discussion differently, Janet?
Thank you, Wahiga. And I want to say this, that in the midst of what many are calling a dilemma on decision making, I'm very clear on my mind that the best thing to do is continued learning, because the risk and the dangers of keeping learners out of school for a period of more than 7 months now is even more riskier, and that is a position held by several other organizations and even the experts and think tanks in education in Kenya. And I also want to say too, that there is a lockdown probably in some of the countries like in Europe that are experiencing a second wave. Schools are still open. I think that's a point that I would want to emphasize. Let somebody do their checks. Even countries that are more and worse hit than ourselves, they have considered schools still to remain open. The thing here is, as a country, we must first classify education as an essential service. We cannot open everywhere else and then still expect that schools are going to be safe. If anybody is going to close anything, they have to close the interactions within the community, and they have to ensure that communities still remain to be safe. But we cannot open everywhere. We cannot open every manner of political, the rallies, and then we expect that schools are going to be safe. So I think the first thing that we are going to do as a country is to first acknowledge that education is an essential. We are talking about 17 million children that are being affected by school closures. So looking at that against what is essential for us, I think one, education is essential, and government should consider what do we close so that we can still continue to keep schools safe. I would want to say this, and I don't know so much, but I want to trace the transmissions you're seeing, the infections you're seeing in Kolanya, in Tononoka, to the community. If somebody would tell me that these people, the infections are happening at the school level, they must be happening at the community level. So the government must arrest the infections at community level by ensuring that everybody else adheres to the set guidelines before we even talk about opening everywhere else. And finally, because this is introductory, I would want to listen to what lessons has government learned, because we opened partially so that government can learn lessons, and also say, by the time we were opening, we were here, I'm really happy about this show because it's really today. You remember schools opened without resources? Remember, government left a lot of the responsibility. All the parents are some of the that are deaf.
Okay, we seem to have missed that last point that you were saying, Janet. What was your last point?
I was saying that by the time we were opening, you remember Waihiga, schools were saying that they had not received the resources, schools had not been funded, and it is a cry that has been coming from the heads of the schools. Could this be one of the issues that is bedeviling us? For example, because the control of COVID was left to the devices of individual parents, individual learners, and some of the schools, we know how these things operate. Could that be probably one of the reasons why we are seeing the spikes in schools? What have we not done right in our reopening? And because we are not the only place that is open, what is happening in other places so that we can be able to see what did we do right and what can we improve on?
Okay, I'll allow Honorable Sosion to weigh in on that, but first let me bring in nominated Senator Sylvia Kasanga. Senator, you can respond to what the other panelists have said about the education sector, but you can also give us your views on the wider picture. Today, many Kenyans have different views of what should happen in terms of an announcement by the president. For example, one viewer yesterday said political rallies, social gatherings, church services, weddings, funerals, and all must be stopped. My goodness, okay, that sounds quite extreme. But from the position you sit as the chair of that ad hoc committee, what, in terms of data or discussions, are you having around the same issues?
Thank you so much, Wahiga. I need to remind you that the ad hoc committee on COVID is actually winding up its mandate. Our timelines ran out. We were given an extension of 1 month to prepare our exit report. So a lot of what I will say here is based on earlier interactions that we had with the various stakeholders, including the government as well, and doctors and other frontline workers, and probably my own personal views, and I will let you know as and when. Now, it is clear, and we have been told, as Sosion has said, it was expected that the community spread is going to come. And right now what we are dealing with is community spread. And for the schools, it does not come as a surprise, as some schools will be affected. You know, Wahiga, when you trace how a student in a day school goes to school, maybe through public means, or even a teacher or a non-teaching staff worker goes to the school, then you realize we have a challenge. If the matatus are no longer enforcing the COVID protocols, if the schools themselves are not tightly monitoring, that is temperature, social distance, as well as washing of hands. Now, if at home, the parent has come from the marketplace where no one is wearing masks, as you have seen the marketplaces, everyone seems to have really relaxed on the protocols, then it is expected that it will creep into the schools. And this is why we are seeing this surge, not just in the schools, but generally countrywide. The relaxation of Kenyans when it comes to adherence of protocols is a really big challenge towards this disease. And that is why you're seeing it going up, because now it's community spread. It's no longer about somebody who has come outside the country, from outside the country. It's about amongst ourselves. And that means it's going to spread like wildfire unless something definitely is done. And I do agree, Wahiga, with the comment that you have read from one of the citizens. We have to now rein in back again on the gatherings, because if Kenyans cannot take personal responsibility, then the government needs to step in and do something. I've said on another platform, Wahiga, that when we started our interactions with the government in this committee, the ad hoc committee, when we started our interactions, some of the issues we were dealing with was the high-handedness that the police was dealing with citizens, if you remember. In fact, they brought fear among citizens when it came to COVID at the onset, when the containment measures were being forced onto Kenyans. And I'm wondering, where has the Ministry of Interior gone to when it comes to enforcement, especially when it comes to gatherings of political rallies and leaders? Leaders were supposed to be leading from the front, but it looks like we are the ones who are ready to expose Kenyans. And this is really, really, really terrible. I said it on another platform. Now that the Interior Ministry has to give permission for public and rallies and political gatherings, why is it that they're not giving those licenses with conditions that then the protocols must be adhered to? And for the leaders or the party or whoever does not adhere to those protocols, then we have to see some action taken against them, and they should not be given another license to hold any other public rally until all this issue of COVID is contained. I mean, the implementation and the enforcement has to be at that level, Wahiga. So this is something that we are pushing. I even said it at the floor of the House yesterday when I laid the 9th report of the ad hoc committee. And the 9th report had largely to do with how ready the counties are. And this is now another issue. Even the Ministry of Health, when they did an analysis of how ready the counties are, the rating was very low. So we are going into a community spread as expected and as we had been advised by the doctors. And in the same breath, our counties are not fully ready to handle this. In fact, Wahiga, I'm sure you've not seen any much tracking and tracing that is going on in the counties, and that is, of course, very worrying.
Okay.
And there's not much enforcement that is happening at that level.
Okay.
Thank you.
Okay, thank you so much, Senator, for that. Let me bring in Honorable Sosion once again. We're here with him in studio. You've heard what the other panelists have said. Janet has asked about our infrastructure, the resources that were to be put in place should there be a COVID-19 outbreak. Are we seeing them? We spoke about a lot of hand washing in schools, wearing of masks, etc. And she questioned whether all that was put in place before students went back
I think
to school.
the most important thing is to honestly audit what has gone on in schools, whether resources were wired. And we've seen the return of the reports from the schools. There was inadequate financing of schools. And this is a big elephant in the house. The primary schools were not facilitated with even a single cent from government. And the secondary schools were facilitated at the rate of 500 shillings per learner for preparations of COVID-19. And the information, even the 500 that was wired to the secondary schools is not adequate. And therefore, this brings me, we even don't need to wait for the audit report from the ministry. It must be there. But then we've learned, we've seen with our own eyes, teachers dying. We've seen learners getting infected. So I think it is futile to talk about recalling the rest of the learners without actually putting in place the necessary measures. And we've recommended, because the ministry talked of parents providing masks to the learners. Then the question comes in, these masks that parents are buying, what is the quality and what is the effectiveness of these PPEs in the form of mask? So I think what government must decide, because when government sits, you must sit and facilitate. It must facilitate this time round the provisions of PPEs. You cannot transfer the responsibility of buying masks to households. That must be provided through schools and through procurement from the BOMs. And when we do simple mathematics, it will just require 1 billion to provide sufficient masks for all learners in the country. And I don't think 1 billion to secure the health of learners is something that is difficult to procure within the economy. If we can get 2 billion for desks, then we must get 1 billion for masks, so that we mask all the learners and avail and also more resources for sanitizers. We cannot talk of reopening of schools without government directly providing the PPEs. That is what in the UNESCO UNICEF protocol. And I think that is what was missing. And for us as a union, and from the experience that has been given by the heads of schools, they cannot adequately implement these protocols without being financed. So financing is number one thing, and it's not a lot of money. It must be procured from schools. It should not be centrally done from the ministry. We have seen, and I think there is a lot of madness in this country that most of school procurement, it must be done centrally, nationally. That is where we are missing the point. Why are the money to schools? The BOMs will provide all this. And looking at the global trend, children cannot be kept at home any longer. In fact, even like Britain, what Boris Johnson pronounced is total lockdown of the country, and except children who are going to schools and sporting events. So I think those are things to borrow. And as we move forward, we must think of safely bringing back the learners to school, but we must avail sufficient protective measures through proper funding, and therefore the ministry must also give us an audit of their experiences and also the strategic plan. Then number 3,
yes,
and we've heard from Kenyans, the crowding in the country. And in fact, if you move through rural communities, nobody's wearing masks. The health protocol measures, they are no longer being adhered to, and therefore totally banning political rallies. We've seen the political leaders in this country addressing huge mammoth rallies and Kenyans without masks. And we are talking about COVID-19. Surely, how do you pronounce regulation and rules, then you go ahead to violate? It is not one of the best things. We must prepare even to get back to the original situations. Churches and all other forms of gatherings. I think something needs to be done, because we cannot risk. We have seen people who are sick cannot get spaces to be treated in hospitals. And the medical personnel are already complaining. They're also not safe.
Okay.
The PPEs and the protection. So we have a whole mess. Is our medical infrastructure even in the first place ready to handle the rest of the population?
That's where I want to come in and
that
hear
is
this.
why, yes.
I want to hear this from you. Hold on.
We
I want
are
to hear this
facing
from
a catastrophe.
you. There are parents watching you this morning. They have students or children in Form 4, in Class 8, in Grade 4, and they are worried. They are looking at the headlines in Kolanya and elsewhere, and they are wondering.
They should not be worried. That I would say very strongly.
What assurance can you give them?
They should not be worried. The learners who are in school cannot go back home. That is fundamentally, even in terms of medical terms, it would be a mistake. Because if you say, for example, students at Kolanya to go back home, you will be enhancing the spread at the community level. The learners who are in school must continue being in school. The learners who are at home, the government must prepare convincingly. This time we see proper funding to schools, provision of the necessary protective equipment for both learners and teachers. You see, we've seen teachers dying. And you see, if you are not providing sufficient PPEs to learners, the learners can even spread the viruses to teachers. Teachers won't be safe. And as a country, I think and there should be no debate and arguments about this.
Okay.
We have been guided by the UNICEF and World Health Organization. Avail PPEs to secure learners, teachers, and workers. It's everyone.
Day schools, for parents of children who are going to school every day and coming home, should they be worried this morning?
They don't need to be worried. They don't need to be worried, but they need to be worried because of what is happening in the communities. We all agreed the spread of the spike of the virus was because of the relaxation of various protocols by government. You allow bars to open up to 11 o'clock. Nobody is very sure whether really this is adhered to. We hear bars operate even up to 4 a.m. And regulations were given for funerals, for churches, persons not exceeding 300. What do we see in funerals? Thousands and thousands. What do we see in churches? Crowds. What do we see in the streets in political rallies? Charged and unprotected crowds. Those are very serious issues. And we think what the government should convince us today, if we have to accept reopening of schools, it is proper cracking of these crowdings within the communities and total lockdown. Then we can discuss on then how to ensure that children are safely commuting between their homes and schools as we receive them back to school.
Okay.
I agree.
Okay.
We must give education the biggest preference, and the learners the biggest preference, and we treat it as the most essential service. And it's an area that government must invest in now to ensure that children are safely moving to school and protected, not only in schools, but protected between schools and homes. And that is why issues of masking, issues of proper guidance, issues of proper, we have to go back to the drawing board to reconfigure the schools.
And it's that drawing board that I want to hear.
And this one I'm telling government and ministry this time round, avail money. Without money,
Janet, hold on there. Janet, 3 weeks ago, you said there's no money that's been availed. Now, Wilson Sossion seems to have the same concerns that you had 3 weeks ago. Talk to us about that.
I really want to welcome Sossion to this other side of the divide because we've had these conversations with him and he defended government to the truth when we were saying that government had not sent money to the schools. Anyway, that is water under the bridge now. And what we are saying is today, ours is a very interesting government. I have said this severally, that COVID is not only in Kenya. This is not a national problem. This is a global problem. Why is Kenya behaving so differently? Why is Kenya not learning? And I think ours is a political problem. We have a political class that is not committed absolutely to anything else apart from what happens in politics. If anybody is telling me today that we do not have money to secure our children, yet we have money to do everything else in politics, we have, it's not fair and it is not fine. And we're telling the president, because we are not going to have this discussion with the cabinet secretary for education. We know his limitations. He has a desire, he has submitted the budget, but who is the owner of the money? There are some people who want to decide where money goes in this country, and they have decided that money is not going to secure the future of our children, but money is going to go into political activities. It is very, 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 very unfortunate. And Wahiga, today I want to tell parents, for sure, that let government control the infections at community level. If a parent today is worried that their child is coming from school, let them also be worried that they themselves are coming from the market. They themselves are coming from the pub. They themselves are coming from that political, and therefore school is not unsafe. If schools follow the protocols that have been set aside by government, and governments have been so guided by UNICEF. So I want to imagine that school is the safest. So that if a child is even at the school and is coming from school, where the school is well guided, they're washing their hands, they have their masks on, I really want to commend what has been happening, because I've heard from teachers and even from learners that classes are of 15 and of 17. It's good effort. But look at what happened to that child when they come from school. The matatu disregards the protocol with abandon. The parents go to every manner of political rallies, the markets, and it is not possible. And let our government be fair to us. It is a global problem. How are other countries dealing with COVID? And why is Kenya behaving so irresponsibly? I think it is a big question that we really have to ask our political class and to tell them that it is very sensitive to play with the minds of children. Right now, we have manipulated the situation so much so that it looks so obvious that our children, we are not going to experience full opening of schools. It is very unfortunate. Why is this unfortunate? Because our neighbors are at full opening. What is different about us as very many others at another level?
Okay, and joining us in studio is Chibanzi Mwachonda, who is the Sec-Gen of KMPDU. I'll be engaging him shortly, but let me allow Senator Kasanga also just to give us a comment on this. Senator, you say that you're winding up the work of the ad hoc committee. I don't know if you're able to give us a glimpse of your recommendations moving forward from what you've been able to assess as the chair of that committee. What might be in that report?
Thank you, Wahiga. We are still working on that report, and we intend to have it ready by next week. And we will have a whole raft of recommendations to go to the standing committees in the House for them to follow up on quite a number of areas that we have not been able to finish. Of course, the health issues, we've already handed them over, so all matters of health are now being dealt with by the the Standing Committee on Health. And we have financial issues and we have economic issues, which we are still winding up on to hand them over again to the standing committees, as well as the education issues which fall under social and public order. Those are, in fact, the education issues are already seized by the Education Committee. And so all the other areas, we are going to hand them over. And right now, I can't give you a full glimpse of it, maybe until next week once the report is fully ready. But there's quite a number of areas that are outstanding. And yes, I agree with the panelists that the issue of enforcement is what needs to be done more than anything else. It's not for lack of protocols that have been given and directives that have been given by the Ministry of Health to Kenyans, but now it's a question of enforcement and putting people to account when they flout the regulations, Wahiga. In fact, I think the president really has a difficult task, and the ministry, of course, they have a very difficult task today with the meeting they're going to have, because, the balancing of livelihoods against, life itself is now really going to weigh in on them. How much containment can they do, again, when we know how poorly our economy is doing? In fact, some of the conversations that we had earlier on to do with the Juakali sector and all the others, which are the largest, employers of Kenyans, we can see there's a very serious challenge. So when it comes to containment, I know they have quite a task in their hands to see how they're going to balance this out. And I do agree again with the panelists that the schools are the safest places. Actually, the problem is between the school and the home. You may find that actually boarding schools that hold everyone, including the staff members within the compound, are probably the most safest places, because then you can control who comes and goes. But for day schools, there's that challenge, which, between home and the school, what happens there in between is a question of enforcement, because it's not for lack of protocol, but a question of now enforcing those protocols and making sure they are being followed. So Wahiga, in regards to our exit report, that will be ready in the course of this week. So early next week, I can give you a glimpse of what it is that we are recommending.
Okay, let me bring in Chibanzi Mwachonda, SecGen KMPDU, into this discussion. Thank you for making time for us this morning. And yesterday we ran a story titled "The Doctor's Prescription." What is the medical fraternity telling Kenyans about what needs to be done or what needs to be announced in today's COVID conference once the president and the governors meet to ensure that there is sanity moving forward in how we are managing this disease? Let me get your prescription, your thoughts on this.
Thank you very much, Wahiga. I think first and foremost is to say that we are where we are because of our own responsibility, and this has started all the way from the top of the political class in this country, and that is why we are having to deal with this situation that has emerged so far. I think the first, and I know what most Kenyans are anticipating, is that you're expecting some sort of lockdown. There are quarters that are pushing for a lockdown, there's quarters that are pushing for containment and restriction that we had seen earlier on in March, April, of certain counties that are high risk. But the reality is, at this point where the disease is widespread in all communities across all 47 counties, that lockdown, that containment is not going to help in any way. What we need to do is, one, to ensure that we enforce those protocols that are there, ban all political gatherings as we speak. And that's what we're expecting. That is what we are putting forth as the doctors. Ban all political gatherings. Gatherings should be limited to, I think, at a maximum 100 with social and physical distancing. There must be enforcement of masks in public spaces, wherever there is. And for those who are unable to afford these masks, then the government must find a way of providing masks for the most vulnerable in the communities. There are people who right now, if you give them a choice between buying a mask and buying food, they will rather buy food and place it on the table. So the reality is that is one of the other things. Another thing is the curfew hours. For us, these curfew hours have to be reduced from the 11. We can go back to 7 if required, up to 7 p.m. so that then now you reduce the amount of time that people are spending out. And why I'm saying this is because, if you remember, we opened up bars and restaurants, and the bars, as we speak, are part of those what you call super spreader places. And this is not just in Kenya. In Europe, in the UK, these are things that have been proven to be part of the high risk areas and activities. So that is one of the things and I know that there are people who depend on this as part of their businesses, but the reality is also that we cannot afford to let this situation go uncontrolled. So those ones will have to be closed down for now. Okay. Yes.
And I wanted to get before we take a break, I'm told we need to take one. I wanted to get your prescription for the educational fraternity. Sosion is keenly waiting to hear what you have to say about that. To close, to keep the current protocols in place to postpone any further reopening of the educational sector. Yeah. What are the options here in your view that are on the table?
So we have worked with Sosion in even putting the initial proposals for the education sector. And what I'd say is that school reopening and the current situation we are seeing is not just unique to Kenya. It has happened in other countries. And what we are seeing now, what we would say is that one, let those who are in the final years that are already in school, let them remain in school, but they must be provided with masks. The teachers must be provided with adequate PPEs. And thirdly, let us also make sure that if the transport between home and school, then schools must be able to provide that transport for their children. And then fourthly, we must have all these schools linked to healthcare facilities in their vicinities so as to take those who are ill for treatment, and these facilities must equally be equipped with healthcare personnel. So it has to be a very closed system to allow less infection into
None of this,
schools.
we had 6-7 months, Chibanzi, to implement this. Do you think it's going to happen in the next 1 month, 1 week?
Unfortunately, that's the reality about our country, but where we are, then these decisions have to be made and this action must be taken, because if this action is not taken, then what we are heading into is going to be very catastrophic, and eventually schools might have to be closed. But at this point, they should not close the schools. The other learners should remain home for now.
The other learners should remain home for now. I know Sosion and Janet and Senator Kasanga have a response to that. I'll give them a chance to speak after the break. But you know what? Let's take that quick break. You're watching Daybreak. Stay with us. And this is what one or two people are saying before we take that break. Let me see here. I think I saw one or two. Jenga Kongu Paul says the surge we are witnessing right now in COVID-19 is a result of giving leeway to unnecessary opening of congested public places, churches, bars, and allowing freedom of movement so quick, since it shows that the curve had really not gone down, it had only stagnated. Okay, that's one. KM Dennis is saying learning is an essential service. It must continue. All right. Hick Sant Dracon is saying lessons are costing health and lives of Kenyans. How many of our children have COVID-19? While Mr. Eri says education stakeholders on this matter need to be serious for once. On that note, let's take that break. 22422 is the SMS line. Hashtag is Daybreak. Stay with us. We'll be right back.